Hello and welcome to the Healthy Christian Women podcast. I am your host, Dr. Melody Stevens, and this is season 4, episode 8. I have a very exciting interview for you, a really great episode that you are going to love it. It's going to really matter to you and probably to many people that you know, many women that you know. I'm very excited to be inviting Jenn and Christina. They are the founders of Tighten Your Tinkler. And when you think about that, Tighten Your Tinkler, what does that already mean to you? Yes, we are going to be talking about women's health and pelvic floor things and everything going down in your nether regions where you might have some trouble, especially all you mamas after having babies. Let's be super honest. Things begin to not work as well as they were meant to. And this can actually lead to a lot of really difficult and embarrassing problems. But Jenn and Christina are incredible. We have an exercise physiologist and a physical therapist, and they have designed an incredible program that has been revolutionizing helping women in this way. So I am thrilled to have you here, Jenn. Thank you so much.
Thanks so much for having me.
Yeah, absolutely. You know, when you reached out to me, I get submissions all the time for people that want to be on the podcast and, you know, promote different things and share different things. And I am quite selective about who I bring on and who I share with my audience, because I'm coming from, you know, a very scientific background. I'm coming from a very professional background, and I want every single person and topic that I bring to my audience to matter and to really touch them deeply. And not that all of these submissions don't do that, but every once in a while, there's one that's just like, absolutely, we must discuss this. This is real life. This is very difficult. Women are struggling with some of these areas, and we've got to talk about it. And you guys have developed an incredible new program that has been really successful in helping that. So I was very excited to bring you on to the podcast. So thank you again.
Oh, well, thank you.
So let me read a quick bio so everybody knows a little bit about you and your business partner, Christina. She's not able to be here with us today, but thank you for representing the two of you. And so Jenn Lormand is an exercise physiologist, author, and mom of 3, living and thriving with a stage 2 prolapse. And if you don't know what that is, we're going to talk about that, because you never know, you might be suffering from that as well. Christina Walsh is a physical therapist specializing in integrative manual therapy and a mom of 2 living with a rectocele. Again, we'll talk about what that is. They have a combined 36 years of experience helping women jump for joy without peeing their pants, ditch the back pain, and have better sex too. We must talk about these issues. This is quality of life issues, right? This is intimacy issues. So I'm so excited for everything that you're going to be sharing today. They're published medical researchers in the Journal of Women's Health of Physical Therapy, where they proved that women can heal without kegels. This is a big one. Women can heal without kegels or inserting anything into their nether regions. Okay. Jenn and Christina have been featured on CBS News along with multiple podcasts. Their mission is to help all women restore their dignity with a simple 10-minute a day routine. It's incredible. Their signature program has been proved to stop pee leaks, discomfort with sex, pressure, back and hip tightness, and to heal abdominal separation. Tighten Your Tinkler is disrupting the current standard of care for women with a simple and innovative approach to help all women finally feel confident in their own body again. This is amazing work. I would love for you, let's break down some of those terms that people may not know. And then I would love for you to share with us, you know, what led the two of you to pursue this and to investigate this, to find a better way, because the current methods that are out there to help women in this area, they're just not as effective as what it truly could be.
Yeah, I would agree. Let's start with, I know, women, there are a couple things that some women are scared to Google, and prolapse is really one of them. So prolapse is simply the falling of the pelvic organs in the pelvic cavity. And I do want to say right off the bat that every single case of prolapse is unique. There are no 2 cases of prolapse that are the same. And but it is the falling of the pelvic organs in the pelvic cavity, and that the number one symptom that women typically feel with that is pressure. Many women, and myself included, I would describe it as maybe you've questioned if you've had a tampon in, or feel like when you do try to wear a tampon, that it feels like it won't stay in or won't stay in properly. Many women have pee leaks associated with this, urgency associated with this, or frequency. So women who are visiting the restroom more than 10 times a day, which is not normal, and planning their life around the restroom, or planning their life around having to bring extra underwear and pads with them on vacation and just in their daily life, back and hip tightness, as we said in the beginning, as well as the most mortifying of these issues, which is all of the bowel issues. So rectal incontinence, rectal pressure, rectal urgency. Many women think that, oh, it's a diet thing, which sometimes it is, but oftentimes that rectocele, which is what Christina has more dysfunction on the backside of the pelvic bowl. Mine is in all three compartments. But those are the issues that we're talking about here in terms of prolapse.
Can you talk about those three compartments? So for women that don't know, and they don't have the anatomy training like we do, so they don't even understand fully what's going on with their body, can you just break that down? What are those three compartments that make up your pelvic floor, your pelvic area?
Sure. It is your bladder, which has the urethra attached to it. So, if we want to, again, with terminology, urethra-cele, which is a hernia of the urethra, a cystocele, which is a hernia of the bladder, the connective tissue. Then you have your uterine compartment, your vaginal compartment. And then you have your rectum, or the bowel, the end of the digestive tract. That, and keeping in mind, and we have a great video, I just will say, we go in depth on our YouTube channel with the pelvis and visual aids explaining this. So if they are interested in learning more, because some of this you do need a visual aid to really be able to digest it, but it's not just falling down, but it's also falling into one another, into the vaginal compartment.
Wow. Okay. Thank you. Yes. And what is your YouTube channel so that we can be directing people that want to learn more?
Tighten Your Tinkler.
Tighten Your Tinkler on YouTube. You will find it there. Yes. Yes.
Yeah.
And so many women, it's very common after women have had babies as well, that now they just get leaking. They just get, like you said, they jump up and down, or they sneeze, or they cough, and then they can feel that something came out of their bladder. And so then that's embarrassing. That's annoying. Yes. That's concerning and frustrating. Let's talk about what was typically done. What is the most common thing that people know to do to treat this? And then how is what you guys have developed different from that?
Well, let me just say that unfortunately, there's been a normalization of these issues, and common does not mean normal. So it is common. We are talking about a population of 52 million women in this country dealing with these issues. Typically, what women do is they do kegels. That's what you're told by your OBGYN to do during pregnancy. And really it's the only pelvic health care recommended by your OBGYN postnatal. So women are either buying the cute disposable underwear, or just dealing with the pee leaks and not worrying about it because it's quote unquote normal, or they're attempting kegels, and many women don't know how to properly do them to begin with.
Yes. And the other thing is, if the problem becomes severe enough that you're really seeking help, you're really seeking medical attention, and there are special physical therapists that deal specifically with pelvic floor. So can you talk to what you see happen in that arena as well? What are some of the common practices to help from a physical therapy standpoint as well?
Sure. So I'll use my own personal story for this. After the birth of my first son, I had multiple birth injuries, a 4th-degree tear, and had lost full control of bowel and bladder function. So that did require me to go to see a women's health physical therapist for the internal work to stimulate the nerves that really turn those muscles on and get things firing again. And certainly Christina and I are not knocking women's health physical therapy. There is a definite place for that, particularly for women who have lost control of those functions. However, I know myself is included in this group. I did not enjoy nor want to be manipulated in that way, nor did I want to take home a device and manipulate myself internally. Because, Kegels, while, they were great, when we know better, we do better, right? The research is always growing and evolving, but Kegels are simply an isometric contraction of your pelvic floor. And that's really not the way that God designed our bodies for our pelvic floor to work. Our pelvic floor is supposed to work synchronously with our deep abdominals, our back extensors, our hip rotators, and our diaphragm to be able to breathe properly. So, that's one of the things that we really do address with the program. Is these are things that when we are getting these muscles activated and turned on, they're actually working functionally for us in the way that our body was designed to move.
Yes. So to break that down, ultimately what women are typically told is to do Kegels, which is a contraction. So you're learning to kind of contract the internal muscles up in that area, and ultimately learn to just strengthen them by just simple contractions, either by how many you do or by learning to hold that contraction for a little bit longer, thinking that just isolating those specific muscles that are getting contracted, that is going to prevent the pee leaks, and that's going to just support everything with just this one particular move, which, like you said, that's not terribly functional. You don't want to have to be walking around all day thinking tighten all day long. That's not, it's not going to be sustainable.
Well, and unfortunately, our experience is that many of the women that do that or are over manipulated then have another problem of the pelvic bowl becomes too tight, which then creates a reemergence of all of these issues. And so it's just a nasty cycle that women get into. And I'll share another quick personal story. It was after my third son where I finally was able to get a referral to see a urogynecologist, which would be the specialist to get the referral to if you think that you are dealing with prolapse. That would be the correct physician to be able to examine you to diagnose this. But I remember distinctly, he examined me, asked me to perform a Kegel, and his eyeballs got so big because I was a Kegel queen at that time. It was before we had done this research. And he was like, well, most women with prolapse, this progressed, do not have the strength that you have in your pelvic floor. I was 36 years old, and he referred me for a full pelvic floor suspension, which you had asked in the beginning. That is ultimately what led to this protocol, was really as a 36-year-old woman, when that urogynecologist looked me in the eyeballs and said, I don't like doing this surgery on women this as young as you, because you're going to have to get this again. And I was just like, okay, I have nothing to lose and everything to gain at this point. I'm going to just try everything that I know to try as an exercise physiologist, thinking outside of the box. So that way, if I do need to get surgery, then I will know that I have exhausted everything that I know to do possible. And so that's, again, another, I was a Kegel queen. And if Kegels really do strengthen those muscles in the way that we need them to function, then my pelvic organs wouldn't have been falling out of my body.
Oh my goodness. And so he was at this stage, he's like, all I can do for you, since you've mastered Kegels and it hasn't solved the problem, all I can do is that we're going to have to go in and typically what do they do? Almost like a mesh, right? They like kind of put in this is what I've heard anyway. They put in a mesh that will kind of uplift and then support those organs again. But then he said, even then, I'm going to have to eventually do it again one day too, correct?
That is correct. Yes.
So before surgery, you were like, let me see if I can figure something else out. And when we look at the anatomy, that's why I think going to your YouTube channel and looking at some of these visual diagrams and videos to help you fully understand, when you look, you're going to see we've got muscles all around this area.
Yes.
We've got muscles coming all the way from our abdominal cavity all the way down. And then we've got our hip flexors and the rotators and the internal inner thighs all connecting up
Yes.
into here, right? Like
That's correct.
our pelvis is surrounded by muscles on every side, inside and outside. And so you're like, there must be something else that with all these muscles here that can help me more than just Kegels. And another thing that you had said, which I don't think people know because I didn't realize it either, was you said another thing that's currently done to help women in this area is a physical manipulation up into, I'm assuming up
Yes.
into the vaginal area.
That's correct.
And
Up into the vaginal opening.
And so that can be effective. However, that is very, I don't even know what the word can be for some people.
Shaming, and it's really, I will
Invasive.
say, it's invasive. And I know for me personally, after having the birth injuries and the trauma with that, it was a loss of dignity to have someone manipulate me in that way in such a vulnerable time. I mean, we're talking about really delicate issues that are embarrassing to go to someone and ask for help with. You know, as a grown woman, to say, I don't have control of my bowel and bladder. What can I do for this? It's very hard to ask for help, and it's something that Christina and I are extremely passionate about, because the messages that we get in our inbox all of the time are shaming by other health professionals. I mean, myself included in this. When I went to my urogynecologist, I had to fight for that referral to that urogyno, because she just said, I see this all the time. This is normal. This is common. Well, okay, great. I mean, it's a shame that it is common, but there needs to be a little more empathy and compassion and information for women to know that, no, this isn't normal. And there are things that you can do to help yourself.
Yes. And the other thing is like you mentioned, they also have type of stimulating devices ultimately that they can put, in both areas, right? But sometimes people don't feel comfortable or want to do that either. And so what I love about what you guys have developed together is it is nothing invasive. It is no one and no thing having to go up inside of you, which can be very embarrassing and shaming and very uncomfortable and all of these things. It doesn't have to be that way. You found a way using specific exercises and a specific protocol to train the muscles as a whole surrounding that area, inside and outside, without anything having to go penetrating inside of you to help with this problem. So ladies, there is help out there. There is different options out there for you. And that's why I knew immediately we must have you on the podcast, because we have to let people know that there are advances in new things that are happening. You guys have a published study in a medical journal. It's incredible to be able to show that, yes, this can work. This not only can work, this does work. And it's just beautiful. And you told me that, shockingly, at least what was shocking to me, is you have received a lot of pushback and a lot of just fighting against this new way that is going against the old ways, which are very invasive and uncomfortable for people. And I just can't believe it.
Yeah, it was very shocking to Christina and myself to get the pushback from other women's health practitioners. And, neither one of us would have thought of ourselves as disruptors. We kind of think of that as like someone angry coming in and like really, but we are fired up and passionate about getting this out there. But better, you do better. And, the more research that comes out, and again, we are not poo-pooing, no pun intended, women's health practitioners. I do think that there is a place for that. But, my wish is that when they do get patients, every single one doesn't necessarily need to be manipulated internally. A lot of this stuff can be taken care of very easily with simply activating all those muscles. So many women are walking around with simple pelvic floor dysfunction, which is a fancy word for you got pregnant, your hips and ribs got wider, and, there are certain things that happen during pregnancy, like a separation of the abdominals. Towards the end of pregnancy, just from a sheer physics perspective and biomechanics, the glutes kick off and the pelvic floor spreads. So it gets weaker. And sometimes these women just need a little nudge to get these muscles back on board and working together again synchronously to get that support. And, I just geek out about this stuff because it is so easy and quick, particularly for those women. I mean, we are truly talking about so many women in the first couple of sessions saying, oh my goodness, my posture has shifted. The back tightness is gone. I feel more in control of my bodily functions. I mean, we promise some money back guarantee in 30 days because truly, if you follow this protocol 5 days a week for 4 weeks, magic happens.
That's awesome. That's so exciting. That's so exciting. It's just like this beautiful glimmer of hope. So for the women that are listening right now that have either been dealing with this themselves and just reconciled themselves to, I guess this is just the way it is. I had babies and this is just the way it is. There's nothing I can do. I tried Kegels, it didn't work. It is what it is. No, it doesn't have to be that way. You can get back the form and the function and the control of your body that you had pre-pregnancy. Yes. And for those that have been really struggling, advanced in age where they're really beginning to lose bladder control or bowel control, this should be a huge excitement for you that there is something else that can be done. And I'm thrilled for the work you guys have done, for the research you've done. And we would love to hear if you want to share 1 or 2 stories as well, just about some incredible things that you have seen with the women going through your protocol.
Well, the exciting and the ones that really pull at my heartstrings are obviously the prolapse ladies in the program. I will say with prolapse, that 30 days to really gain back full control, you're going to start to feel the difference in the first 30 days. There's going to be some improvements, but to get back to exercising in the way that they were, that's really more 90 to 120 days to really strengthen that. So I don't want to overpromise results in that regard, but there's been several ladies who came to us who were referred for surgery, who didn't need surgery, who came to us and had, 1 stage of prolapse and reversed a full stage of prolapse. And just for reference, it's stage 0 to 4. And I will say that our program works best for stages 0 to 2. We can confidently say that you can reverse that. We have worked with women who are more progressed, but sometimes they need the assistance of something like a pessary, which is kind of an insertion of a device that's like scaffolding for the pelvic bowl. So those are my favorite. Women who were told by their doctors, they kind of got stuck in that cycle of frustration where they've had injections in their hip and back for pain and didn't recognize or connect the dots that the separation of their abdominal muscles and the pelvic floor weakness and the P leaks and the back stuff is all connected and can be fixed with one thing. So, hearing those, voice memos and getting those emails and getting those messages in our private group, it's what we live for. It really is. We're on a very, very big mission to ideally get this type of care accessible to all women.
Absolutely. I love that. And so, like you said, it's a program, it's a training program for all these different muscles surrounding your pelvic area, and no type of devices that have to go inside of you. Everything can be done externally, which is so fantastic. giving you that privacy and that dignity to be able to do that and complete these activities. And you said 5 days a week for 4 weeks is kind of the initial, getting started, really giving that big push to
Yes.
start seeing and feeling changes and differences. That's amazing.
Yes. Yes.
So we have a special code for all of my listeners here. So we will get you that special code so that you can get a discount for those that want to check out the Tighten Your Tinkler program and really step forward into the research that Jenn and Christina have done in order to move forward and make tangible change in this area that you thought you just had to, well, it just is what it is. I guess this is my life now. Doesn't have to be. And so we've got a real special code for you guys as well.
And if we can just wrap up, because I do want to speak to the ladies who may be having discomfort with intimacy, because a lot of these issues that we're talking about, while they're emotional with our own self-confidence in bodies, it also has a tremendous impact on your marriage. And I know that was true for me. And all I can tell you is we have so many testimonies of women who aren't afraid anymore of the pain and discomfort that was caused by intimacy, and improving that part of their lives as well, and being able to nurture that relationship as well. We can also send you our partner guide. That is kind of a document that walks you through, and I know I needed this for myself, of how to even talk to my husband about this, how to discuss these intimate issues and explain them to your husband, because I know many of the women that I talk to in our coaching program are embarrassed to even have that conversation with their spouse.
Absolutely.
Another great place that women could start is if they come over to tightenyourtinkler.com. If any of this resonated with you and you're thinking, gosh, is this me? We have a 5-minute quiz that you can take that will grade you based on our study participants, and kind of give you a range that you fall into in terms of severity of issues, and make some recommendations for you.
Wow, that is fantastic. So that is tightenyourtinkler.com. Very catchy.
Yes.
I think that's a very sweet way to be handling a very delicate situation and a very personal thing that women are going through. So tightenyourtinkler.com. I love that. I think taking that quiz, that sounds wonderful, just to really have a better idea, where do you fall and what are those next steps that you could do. And the partner guide, I mean, that's beautiful, because man, you've gone through so much, having a baby and having this crazy life altering experience.
Yes.
And then when your body isn't the same afterwards, and that absolutely is going to affect the intimacy with your partner, with your husband, how very, very challenging. It just adds another layer of the new life that you're trying to step into as now being parents and being a mom, and all the life disruption that happens. And then now you have this extra disruption between you and your husband because of these issues that are going on in your body that weren't there before. And so I love that. I really appreciate that. I love that you guys have not only found this incredible protocol that is better than Kegels, let's just say it is better than Kegels, more effective, and it doesn't involve inserting of a device or having to get manually manipulated by a therapist or by a doctor. It doesn't have to be that way. That you have gone not only to research that and to publish that and to see these tangible results with your clients, but to have that other emotional side of things to really help people navigate, how do I have these discussions with my husband, and what am I even feeling? And then knowing that what you're feeling, you're not alone in that.
Yes.
Beautiful.
Yes. Yes. Well, I appreciate that. Yeah, it is, we are heart-centered folks, Christina and myself, and we are grateful to be able to do this work together.
That's incredible. Yeah, I love it. Yeah, God has definitely set you guys on an incredible mission that is very meaningful to so many. So for our listeners, head over to tightenyourtinkler.com, as well as they can find you at Tighten Your Tinkler on Instagram, correct?
That's correct.
And your YouTube, Tighten Your Tinkler on YouTube, for those amazing videos as well. And then take a look, take that quiz, and go check out the Tighten Your Tinkler program and really be able to have some very hope there's light at the end of the tunnel, that what you're currently living in and these changes that have happened with your body, it doesn't have to end there. So that is amazing. Thank you so much, Jenn. Is there anything else you'd like to add or anything else you want our listeners to know?
I think you hit on all the notes. That is our mission. Don't lose hope. There's a way to restore your dignity without inserting anything into your nether regions or having to worry about if you're doing a Kegel right.
Absolutely. Yeah. Thank you so much. We appreciate having you here on the Healthy Christian Women podcast. I know that God is going to use this to speak directly to the people that need this hope and they need to hear this. And so I'm thrilled to have you here. Thank you for being our guest today. And please give Christina our hello and our love for not being able to be with us today. But thank you.
I will. She was sorry to not be here.
Absolutely. Well, all right, everybody. Have a wonderful rest of your day. Thank you so much for joining us with the Healthy Christian Women podcast, and we'll be seeing you later. Bye.
Thanks for listening. Remember to subscribe and join me next week for the next episode of the Healthy Christian Women podcast. Inspiring Christian women to live healthier in their mind, body, and spirit, one day at a time. Grab your complimentary mind, body, and spirit detox checklist at healthychristianwomen.com/detox. That's healthychristianwomen.com/detox.